I'm apparently something of a medical mystery. I've got this assortment of symptoms, the majority of which have yet to get some kind of definitive diagnosis. A doctor shrugging about what's going on is less satisfying than something you can look up, especially when they seem less than inclined to treat the symptoms, but let's not get ahead of ourselves. There's a kitty in the green screen. So please allow me to educate you on the many fun tests and procedures somebody with enigmatic nerve and autoimmune problems can look forward to. This video made possible thanks to the continuing support of viewers, patrons, and PayPal pals like you. Thanks! Yes, dear viewer, YouTube's resident cognitive psychologist is back talking about her assorted health stuff. The last time I did was in early 2023 in the context of medical limbo, the not fully hellish space one can occupy while dealing with health problems that aren't straightforward. We went through the systemic problems with the modern medical system that, when combined with cognitive heuristics or biases, i.e. thinking shortcuts on the part of the doctor, can cause a patient to end up there. Then I talked a bit about my personal limbo at the time. That video was the first I tried to weave in an educational component, as I had shared about my health struggles before that, but in the sorry videos are taking a bit longer than I want context. When that video was made, I had just switched health insurance plans to the most expensive one offered by my husband's employer, and was frustrated by my new care team, because right out the gate, it felt like more of the same, and the same up to that point was horrifically awful. Gaslight, gatekeep, doctor, boss. Doesn't have the same ring as girl boss, but definitely true. So at this point, I do finally have some good news, even with how vague things still are. 65 appointments later, and I am mostly out of that medical limbo state. Mostly, but we'll get there. And since we are a couple months short of 3 years since that last update, and things have mostly settled down, and I do periodically get people asking how I'm doing or hoping that I'm doing better than I was, seems like a good time to talk about it again from a new angle. This time around, I thought it would be interesting and informative to talk about the things my body has been put through on my medical journey. This way, I can update people who are curious about how I'm doing, especially because the last video was so negative, and you'll learn something about a whole variety of tests, treatments, and procedures. And because this is YouTube after all, I'm going to be putting these in the tiered ranking structure that we YouTubers are so fond of. S to F, S are going to be the relative walks in the park, and F is reserved for the absolute worst experience. I'm not overtly theming the different bins, but some patterns will emerge. Sound like a plan? Good. So a rough outline of everything we're going to talk about, and just a note at the outset here that some of these will have clusters of things, but for all of them, we're working through chronological order, basically. We're going to start with the medical experience most people have had. Your vaccines, your childhood broken bones, your appointments related to having an AFAB body. In part, so you can see how my scale is calibrated. I finally got a kitten. I'm not sure what would be the next most common. I feel like acid reflux is a common enough problem, so if you get treatment for that, you might go through some of these tests at some point, if you're so lucky. But this is where we start tipping into my more weird, obscure problems, even in the second, more common category. Then we'll follow things south into more weirdness before hitting what's going to be the most complex of categories, because my nervous system is all kinds of jacked. We'll close out the rankings with stuff that didn't fit the previous bins, and it's one thing, but not. It's complicated because I'm complicated. And the last thing, again, in part because I am in such a substantially different place than I was a couple years ago, I'm going to just summarize the treatments for all of my problems and where there's still unknowns or room for improvement. And part of why I want to do this is just sometimes you stumble across a random YouTube video that has a little snippet of information that helps you on your own medical journey. You never know, it might be that day for you. And an important note is we're going to be talking about medical stuff. There's going to be visual aids to go along with things. So I have been careful in picking the images. Nothing is bloody and are at most as graphic as what you'd see in a textbook or on WebMD, maybe even less so. But there's going to be needles in some of the pictures, and I'm going to just be pretty frank about what's going on. Like, I'm not going to dress it up or use euphemisms or anything. So I generally have an iron stomach for stuff, and am ruled by my curiosity. I understand that it's not the case for everybody. So if needles or medical stuff just icks you out, this is a video to skip. And the last little bit before starting is the standard YouTube call to action stuff. Like this video if it's been interesting or informative and maybe edutainmentful. Subscribe for videos that are nothing like this one usually. Hit up my Patreon for cognitive psych rambles or other media stuff that strikes my fancy, or even cats. One of the early rambles was trying to figure out the D&D classes for the kitties, what they would be. That was fun. Also hit up my fourth wall store to show the world how much you like your citations, or need your citations. Not that I'm wearing a sweater. I was feeling rather pedantic for this video. Hoodies, mugs, stickers, what have you. Also, if you like the vibe of these slides, I made them in LaTeX, and like the slides and my script here, because this is how I used to do my lectures when I was adjuncting. Very handy, especially like, ooh, you can see the little bubbles for how many slides are in each section. Very nice, very customizable. Yes, LaTeX. So if you aren't sure how to get started with that, I have a video explaining the basics and some example resources for you to just get started with it. And the only thing this will cost you is your time, because LaTeX is free, as are my resources. But, you know, tips are always appreciated. Yeah, Max. And with the kitty playing with the green screen, it's time to get the show on the road. Common medical experiences. As I said before, more people will have experienced these things, assuming bodies with relatively normal functioning. And unless otherwise noted, all descriptions of things are sourced from the CDC, Mayo, and Cleveland clinics, and Wikipedia. Starting things off relatively easy, we have the perceptual tests. And I'm not sure why some of us were pulled out of class for these in elementary school. In my case, maybe it's because my dad worked for the public schools, so we were there. The vision test has you read things off a chart at a set distance, and they start off pretty big and get smaller as you go down. And the kid version has E's pointed at various orientations, so you just like that way, that way, that way, that way. So the level of literacy of the kid isn't relevant for how well they do on it. So you work your way down until they become legible, and you're basically at chance levels to figure out how your vision is. This is a quick and dirty way to get a rough idea of how your vision is, and it's super important to do these sorts of screenings in elementary school to catch if a kid can't really see what's going on, because it's super easy for them to fall behind if they can't read what the teacher's putting on the board, or even what's in front of them. For the hearing test, you're put in a quiet room at the very least, if not a properly sound dampened one, and are given headphones, and it's your job to indicate when you hear a tone and which side you hear it in. And the tones will vary between a very high pitch to a very low pitch, and quiet sounds to more loud ones. And from your pattern of responses, your audibility curve is figured out. And similar to the vision test, it's important to check to make sure that kids can hear everything that's going on in the classroom so they don't fall behind. These are both going to go in A for me, largely for anxiety, especially for the hearing test. I think I've almost always had a bit of tinnitus, so the ringing in your ears. And so sitting there listening, it's like, did I actually hear a tone? Or is it just the ringing getting a little bit louder? I can't tell. And as a kid, I had 20/10 vision, so great. But, you know, I'm getting older. It's not as good anymore. And also the astigmatism is kind of annoying. So I have some vision correction that I do wear periodically, very sporadically. So going in to the eye doctor for that stuff, it's a bit stressful because is it better one? Better two. And it's like, sometimes it's obvious and that's fine. But then when it gets into that really finicky, better one, better two, and it's like, I don't know. It's stressful because I feel like if you mess it up, you're going to have a kind of off prescription for the next year. Stressful. Up next, something that wasn't contentious at the start of my life, vaccines. You're given a shot of something, not dead baby cells, RFK, Come on. Something that will teach your immune system how to respond to threats it may encounter in the future, so if and when it does, it can launch an appropriate response. By and large, these are going to go up in my S bin because I like not dying or getting severely sick from preventable things, and just a little shot, nice trade-off. The one exception here is the COVID vaccine, and that's going to go in C for COVID shot, because my body has zero chill about seemingly anything. And for whatever reason, I think it's the way the mRNA is made in the muscle cells. I get the COVID vaccine, and then for the next handful of days, I'm just going to be in pain. Like 24 hours after the injection, if I'm vibrating, I'm in so much pain. Don't get me wrong, I would rather deal with, 4 or 5 days of suck rather than raw dog a COVID infection. But it's still not an optimum experience for me. Then we've got X-rays, where your sorted innards can be checked by shooting high energy electromagnetic radiation through your body. Very metal. This is usually for harder structures like bones, but some organs can be checked in this way too. I got my first one of these in 6th grade because I fell while I was dancing onto my wrist, and it took the brunt of the fall. Gave myself a little pressure fracture. Not a full break, but still painful. I'm going to put these in A. It's very cool and diagnostically important that we can see this stuff, but I don't love how many of these I've had over the past couple years because it is ionizing radiation. And also because the dental version's painful for me. And that's yearly. I have a small mouth, so when you have to bite down on the thing, it just digs into everything. So it hurts. A. Magnetic resonance imaging, or MRI, use magnetic fields oscillating the hydrogen nuclei to get good images of your internal bits. And these are a lot better at the soft tissue stuff, so like brains look great in MRI. And another bonus, it's not ionizing radiation, but it does have its downsides. First, it's loud. Generating and manipulating those magnetic fields with the machinery is loud. Second, it's not as fast as an X-ray. Getting those high-quality resolution images takes time. And third, it's not the nice open experience of an X-ray. It's this cramped little space that you're put in for at least 20 minutes, if not an hour. My first MRI was also in middle school because of some really nasty pain in my lower back. As in this picture, I was put in feet first, so my head got to stick out, which was great. Also, they let me listen to music, which isn't something that's been offered since. It turns out my pain is from this thing called spondylolysis, which is different than spondylitis. Spondylolysis means that I have these little hairline fractures in my back. 2 vertebrae, don't remember which ones, but those hairline fractures are still there. So that's fun. I probably got it from dance. So it goes. Anyways, MRIs are also going in A. When you're put in feet first, aren't injected with anything, and it's on the order of 20 to 30 minutes. There are loads of things that can be figured out with a simple blood test. Nutrition states, hormonal levels, what's up with the blood itself. Even some disease states have identifiable biomarkers, like if you've had mononucleosis, Lyme's disease, or if your immune system is out of control. Personally, I'm fine with needles, but I have delicate, twixy little veins, so this is going in A. I've had to be restuck too many times for this to go in S. And we've got another experience thanks to dance. I developed bursitis in one of my hips, and that's when the gushy little sac in the joint gets inflamed. It didn't matter if I was standing or sitting or dancing or whatever, it just hurt. The treatment for it was to inject a corticosteroid into the hip joint. So they had to position me on the exam table so my hip joint was open, and then they just went in with this huge needle. But hey, it worked. Altogether, I want to say this could go in A or B because I have a vivid memory of that needle. But grand scheme of things, it was over pretty quick and wasn't too bad, so A. So also related to my hip, actually, I had this big nubby mole on one of my hips, and In high school, I thought maybe it had changed shape at some point, so they removed it. And because they checked to see if it was cancerous, it's technically a biopsy. It was fine. They just injected a local anesthetic and then cut it out. And I don't think they used stitches. Just trying to remember, and Dr. Mr. the husband, then Mr. the boyfriend, was with me, and he doesn't really remember either. I thought maybe it was glue. He thought maybe it was a butterfly Band-Aid. Either way, wasn't too bad. Other than the big pad Band-Aid they had me walk out with. I'm going to say this was S. The removal was easy, the heal was easy, and there is a scar there still, but it's not obtrusive. And then we have intravenous therapy. I think everybody just calls this an IV. And this is when you have a direct line put into a vein so that fluids, medications, nutrients can be injected into the system directly. My first IV experience was during grad school in the middle of my week-long qualifying exam when I got hit with the 2009 H1N1 virus that was going around. I couldn't keep anything in on either end and was feeling absolutely crummy, and remembered one of the other professors talking about having a stomach flu sort of situation and going to the ER and getting pumped full of fluids and feeling better. Feeling the time crunch of this exam and feeling like I'd already wasted a day to this, I can't afford to do more, I did the same. Or at least I tried. It got complicated because my heart rate wouldn't go below 130 beats per minute, even after putting a couple liters of fluid in me, but that's a problem to talk about later. Because this involves needles needing to successfully enter veins, this is already starting with a handicap for me. So they're gonna go below blood work in B for blown vein. So the next IV I had was decades later, and they were trying to put one in the back of my hand, and there went the vein. So because of that, I have had IVs put in some really random places, and let me tell you, having an IV here on your dominant hand for like over 24 hours sucks. Now, ladies and AFABies, let me know in the comments where these next things rank for you. If you aren't familiar, that duck-looking thing is a speculum, and that will be inserted and open inside the vagina, so the healthcare professional has easier access to things. Not doing that, oh my god. And can also see what they're doing. And that isn't comfy, especially if you're on the younger end of things or haven't had penetrative sex yet. So while they're in there, they're looking at the general lay of the land inside the vagina, but they will also do the pap smear, where they scrape off a little cluster of cells from the cervix to check for cervical cancer. And it's pretty normal to have some spotting of blood after that because they just did a little wound on your cervix. Also kind of sucks. And if talking about any of this anatomy just age-gated my video, YouTube, this whole process is a bit uncomfy and awkward, and despite knowing that all these medical professionals have looked up many a hoo-ha, I still get a bit self-conscious. Although at this point in my life, I'm a bit desensitized to it all, so while we are in here, as it were, we can talk about the intrauterine device, or IUD, form of birth control. So they've got you open with the speculum. They can slide one of these T-shaped things in, and they fold the arms down. It's like a special little tool to do it. They slide that up into the cervix and then deploy the arms so it holds it in place, and voila! You have a installed form of birth control that lasts for a couple years, if not 8 to 10 years for the copper version. There are hormonal and non-hormonal varieties. Personally, I have to use the non-hormonal copper version because my body doesn't respond well to hormones. Probably progesterone, and probably even my own if the timing of my eczema and vestibular migraines are anything to go by. The copper version works by triggering a localized immune response that makes the area inhospitable to sperm or fertilized eggs that are trying to implant. And this is quite possibly going to sound very weird and foreign to people who've had these, and it's probably indicative of just how out of whack my internal pain scale is, but getting an IUD in and out wasn't that bad for me. It's a moment of discomfort, bad discomfort, and some soreness after, but I've weirded out or surprised at least 3 healthcare professionals. First was the health center nurse who installed the first one. and was just surprised that I didn't make a noise or flinch. And the later two was an OBGYN and his nurse who removed the first and implanted the second. And just the nurse even said like, wow, you didn't even react. Freak. Subtext, freak. So for those who've never had the joy of having one of these tinkered around within your body and maybe aren't aware, there has been discourse around people deserving the right to have access to some form of anesthetic to put these in because it is that painful for them and that awful. And I fully support that. Like, pain management is often inadequate in healthcare settings, so I get that. But I was surprised by how many people were describing just how awful this was for them, when for me, just meh. So forgive me, but this is in my A bin. For me. I fully acknowledge that I might be a freak outlier here. So please don't use this to deny other people adequate pain care options. Mammograms are x-rays of breast tissue to screen for breast cancer. And in this, you basically lay one out on the little surface for the machine, and the tissue is squished flat, which also holds it in place. And so it's squished for a couple different orientations in the machine on both sides. This is going in my B for squished breast. I've had this a couple times now, and it's so uncomfortable. And you're having to stand there with it clamped down, hug the machine in awkward positions, hold your breath, balance a small dog on your head, all while this sensitive tissue is being squished within an inch of its life. Again, this is an important diagnostic tool, and it's important to spot cancer early. Assuming it will for me, because my tissue composition is of a form that makes it more difficult to spot in a mammogram. Yay me. So it's important, but I'm still gonna whine about it. I'm not going to rate medication as a treatment because it's been all over the map for me. Some have been great, like abortive migraine medication has been mwah for nipping my periodic dizzy episodes in the bud. Some have been absolutely disastrous, like the preferred medication for nerve pain, carbamazepine, decimated my platelets. Like, I was just above the threshold where they would have had to have given me a blood transfusion, because if I bled anywhere, I could die. And also resulted in my GP at the time giving me the sage advice of try not to get in a car accident until these come back to normal. To spoil things a bit, I have some nerve stuff wrong with me, and I have an extensive list of medications we've tried that, at the very least, I have sensitivities to. And sensitivities include things like developing nasty headaches, nausea and vomiting, violent shaking, extreme dissociation, and so on. Broadly, medications can be helpful, especially if you aren't me. Just make sure that the trade-off between the side effects and the main effect is worth it for you. And that is it for the relatively common things. The COVID vaccine is the lowest in C because of how brutal the next couple days are for me, and everything above it involves varying levels of discomfort. But that COVID vaccine is certainly not the worst thing I've seen, and we haven't even hit the pseudoscience stuff yet. Digestive. As I said in the outline of everything I've experienced, I'm guessing digestive stuff is the next most common. It's certainly where Dr. Mr. the husband and I have the most overlap, outside of back stuff. All of my experiences in this category come as a result of me having difficulty swallowing food, something called dysphagia. So I've had difficulty swallowing pills successfully and it not adhering to the sides of my throat since forever. But 2017, I had my first incident of chewing something, admittedly not as well as I should have, and it getting stuck, just not moving. I was able to keep the panic at bay because I realized that I could still breathe. Doesn't mean I'm choking if I can still breathe, I just need to be patient. I tried drinking some Coke, admittedly. I was having a burger, and it just sat on top of it. It was not moving. Waited long enough, it felt like an eternity, but it was probably just a couple of minutes, and eventually it went down. Over time, this progressed to things just getting stuck and refusing to keep going even after waiting a period of minutes, and that requiring that you hook it back up. Not fun to do, especially when you're at a friend's house having his cooked food for the first time. And eventually, this happened with a fairly liquidy soup, indicating that it wasn't some user error in the size of bites I was taking or how well I was chewing it. It happened with soup. It took a lot of self-advocating and herding some medical cats, but eventually I was started on the diagnostic process. And we are going to not include a huge rant I could put here of all the medical gaslighting I experienced in this, of being able to do a normal swallow in the test and getting a somewhat trying to be helpful, see, no, you can swallow. It just must be some anxiety that gets you time to time. Have you considered looking into anxiety treatments? Trust that there was way too much of that in this process. And an umbrella comment at the start here. The prep for most, if not all of them, was stopping solids at midnight before whatever test or procedure, and liquids 4 to 8 hours, some window before the test. I can't remember if this is true for the barium swallow, especially the upper barium swallow. Pretty sure it is. I have had way too many of these. All right, so the first test I had done here was a fluoroscopic esophagram, more informally, a barium swallow, because you're swallowing barium. In this, you are given something containing barium to eat or drink, and as you swallow it down, an X-ray video is recorded. And barium is opaque to X-ray, so it's not letting the little X-rays pass through, and so it looks white when viewed in this way. And yeah, it's done as a video so they can see the process as it's happening, and if there's things going wrong along the way. Like in this picture at B and C, this person has a little nub coming off the main esophagus that the barium is getting stuck in, and presumably other things as well in their day-to-day life. Now, some important sphincter context, and what other YouTuber has said important sphincter context? I think you owe me a like, if not a subscribe for that. And for the factoid that you have over 60 sphincters in your body. I'm waiting. So of these sphincters, the one that most people associate with being a sphincter is at the end of your digestive system, but really it's just a ring of muscle that controls the flow of stuff through the body. You got one in each eye controlling the size of your pupil, which controls the flow of photons into your eyes. You have a bunch that control the flow of blood into capillary systems, and yes, your digestive tract is full of them. Because what is your digestive tract if not one long tube with a bunch of sphincters controlling the flow of food as it goes through? The two we're interested in here are the upper and the lower esophageal sphincters, because when you eat or drink something, there's a complex pattern of relaxing and contractions that need to happen for the stuff to make it down smoothly. And there's a lot of points of failure here. So when stuff would get stuck for me, it felt like it was happening pretty high up. But turns out our sensation and perception resolution inside your esophagus is pretty garbage. Given where I said it felt like food was getting stuck, I can understand why they started me with an upper barium swallow. So they're looking at the upper sphincter and the process there. In this, I was given a couple different thicknesses of a berry-flavored barium drink, a barium, if you will, even though it was berry yuck, as well as a turkey barium mayo sandwich to take a bite and swallow of. I was not consulted on this. I don't know what they would have done if I was vegan or gluten-free. Anyways, no problems were observed in my upper swallow process, and we're going to move on before the rant even has a chance of developing. I'm going to rank all of the barium swallows together because they're roughly the same, so just put a pin in this for now. So then we switched health insurance plans from Kaiser to Blue Shield, which then resulted in a major shakeup in my healthcare team and the soup getting stuck. Finally, I get a GI doctor. One who gave me terrible medical advice that resulted in me developing a stricture and complicating my life, but the first thing she did was order me an endoscopy to get a lay of the land. In an upper endoscopy, because there's also a lower endoscopy, a flexible instrument with a camera and a light is fed through and down, I think pretty much into your duodenum or down to your duodenum, which is where the stomach switches over to the intestine. Pictures are taken along the way, and they're looking for any weird structures or things that shouldn't be there. I've always been under full general anesthetic for these, so I am out. But I have seen a GI doctor do this to herself while standing, so presumably I guess you could do it without if you're comfortable. The internet is weird. In my first upper endoscopy, they were mainly looking for any physical abnormalities that might be causing my dysphagia. They didn't find any. At this point, I have had several of these, each with their own little goals. For this ranking, I'm just going to rank the upper endoscopy itself. So, because I'm under general anesthetic and not having to deal with anything, this would go into A because the prep for it is a little obnoxious with the general anesthesia, but with everything they're doing, like the jostling of my mouth while I am unconscious, and the mouth guard, which sometimes they put in with me, sometimes they put in without me, all of this will trigger my trigeminal neuralgia. So the rest of my day is gonna suck. Also, my experience with these has been that the endoscope irritates my throat. Like, doesn't matter what they're doing. If they're even just looking, my throat feels like raw hamburger for at least a couple days after. My husband didn't have that experience, so this, again, might just be because I'm a small person. But yeah, so this is B. So with nothing obviously structurally wrong, the next step was an esophageal manometry. In this test, a thin tube, went through this, did a practice run of this with my husband as a source script review, and he was like, no, thin. It wasn't thin. A thin tube is fed up your nose and down your throat. They have you snort a numbing goo first, so it could be worse. With that tube in place, they recline you so you're on your back and you have your little cup of salt water and a straw. And so the process for this, for all of the iterations except for a very special occasion, the person administering the test will tell you, okay, take a little sip of salt water, hold it in your mouth. Okay, swallow, and you have to swallow once and then not use your throat muscles again for a bit and relax. And you just repeat that over and over again. The manometer measures the contractions that are happening as the liquid is passed down your esophagus. And you end up with this very pretty plot of the strength of the contraction over time, over the distance of the esophagus. This is easily the worst thing I've had to do, hands down, no question, F. The instrument, because of how rigid it is, because there's an instrument in it, is painful. And you have to swallow with it in and sometimes talk to the guy. You have to do a bunch of these sip swallows laying down and upright of that salt water on an empty stomach. Gross. And you get to do bonus of them if you have a sort of double tap swallow like I sometimes do. Or I do the initial swallow and then immediately follow it with the second one just reflexively. So you get to do extra. So you do your laying down ones, and while you're still down there, you have to do some rapid fire, like 10 in a row, sip, swallow, sip, swallow, sip, swallow. So you're just getting that salt water in there. And so I'm doing it. I'm trying to be a good sport. You know, it kind of peters off by the end. And previously he had given me a barf bag. That should have been a warning. So I'm laying there. I'm barely holding on to all the salt water I've drank. And he's like, I think we can get a clearer one if we do it again. I'm trying. And by like sip, swallow 6 or 7, blah, blah, I was nope. Fairness to the guy, he did seem to feel bad after that. But we weren't done. Like I said, that was just the recline. Then I had to do a full other series sitting up. This whole experience was torture. The silver lining to this, the only positive of this whole thing, was there was something wonky with my swallow. So finally, I had a symptom actually show up on the day of testing, which is a relatively novel thing because of the seasonal dependence and when appointments end up happening. So, have a wonky swallow in the torture test. It is time to do another barium swallow, although this one is a timed barium swallow, and we're looking now at the lower stuff. And the timed part here means that we are talking on the order of minutes. So the upper was timed. It was a little video of a little bloop swallow, but with the timed barium swallow, they're talking on the order of minutes. A couple minutes to 5 minutes, depending on where they think the ceiling needs to be for when you time out the test and you fail. The leftmost picture here is of a normal barium swallow. Things are going down as they should be along the entire process. Its sister there, something is going wrong with the lower esophageal sphincter, and things that they have swallowed is just pooling on top of it. And so that same sphincter's not letting stuff through, ballooning on top is also happening on those rightmost pictures. My barium liquid swallow, so the berry yuck liquid if you recall, was a little sluggish, but within the 2-minute window I was allotted. And just when I'd lost all hope, they gave me a barium pill to swallow. That pill got stuck above that lower sphincter, and the fun thing about these is you get to watch it too. Like you can see everything that's going on. So I got to see exactly where things were getting stuck. So I've since properly calibrated where that lower sphincter is, because it feels up here, but it's down there. And it got stuck. And I timed out the test, which was 5 minutes. It just stuck. And it was sweet. The nurse who was in there with me was trying to reassure me that like, it'll solve. I'm sorry, it's not moving. Like, just keep drinking water. Maybe we can get it to move. And it's like, no, it's not moving. This is fine. This is good. And also, this is normal for me. Why do you think I'm here? I'm not worried. Editing cast, because scripting and filming cast forgot to rank the barium swallows. All things considered, I'm going to put this in B for berry yuck. The taste does little to hide just how gross that liquid is. Couple on to that, you have one of the instances, top 5 instances I'd say, of somebody just dismissing everything I'm going through to my face, and also having to do this sometimes without being able to drink water afterwards. Yeah, no, it's not great. B. So the next thing that was supposed to happen was a functional lumen imaging probe, also called a flip. I say supposed to because that's what the GI doctor told me was going to happen. But these are done in an endoscopy. And I show up to my endoscopy and the person who's going through the paperwork is like, okay, well, you ready for your Botox shot? Now, I am somebody who does a lot of research, and not the Alex Jones type of research, but like digging into whatever little medical journals I can find research. So I knew Botox shots are an option to paralyze the sphincter so that food just passes through. So yeah, sure, I'm game. I didn't see the point of doing the flip necessarily. I wanted to see if something like that would help the food pass through. Yes, let's do this. And wouldn't you know it, that little shot helped. Food was passing through no problem. Great, right? Follow up with that doctor, and she was mad with me, that I didn't have the flip done and had the Botox shot done instead. Like this was something within my power to change and not an error somewhere in the process, quite possibly from her desk ordering whatever she did. And this was also the appointment where she told me, you don't need to continue on the omeprazole. You can just stop whatever antacids you're doing. This resulted, almost certainly at this point, resulted in acid coming up because there's not a sphincter holding it down anymore, coming up and damaging my esophagus, resulting in the formation of a stricture. And this stricture is going to cause me lots of problems down the road. And I don't have it in my script, I forgot, but the Botox shot, let's say A. It was great. The big flaws with it are you have to be in an endoscopy for it, so you have to do the full general anesthesia, everything. And also, it doesn't last forever. So you have to keep coming back for it, which I didn't really want. Now, this GI doctor, in addition to the bad medical advice, was dragging her feet on exploring potentially more permanent solutions. I, having experienced the promised land of a swallow that just happens, wanted a more permanent solution because I didn't really love the idea of having to come back every 3-4 months for full endoscopy, full anesthesia, and full Botox shot until I die. So stuck to my guns, and eventually she relented, and I think just out of tired exasperation referred me to have a permanent solution done. So this next part was incredibly painful for me psychologically and physically. And if you've been around my channel, you've seen the videos. Something I've only briefly touched on here are the years upon decades of bad treatment from doctors and nurses and other healthcare professionals that over time built up into me having some trauma in medical situations. So it's not too bad now with my healthcare team for the most part. I have pre-established relationships with all of them, and I basically trust them to do right by me. But with the stricture, it triggered my trauma in a bad way. So I was booked, I was prepped, I'm in the endoscopy for this surgery, and so the surgeon's in there, and he sees a stricture, a Schottky ring, if you're curious. And for whatever reason, despite this not having shown up in any previous thing, he decides that this must be the cause of my dysphagia, and so is going to do a more conservative treatment. And on some logical level, I can understand that. Go with a more conservative, reversible treatment instead of the permanent one to see if it would help me. But I was not consulted about any of this. I had not given consent for what he did. It wasn't even discussed as a possible option of if they see something weird or surprising in there. My husband is my notification person. At this point, he is my proxy to prevent this sort of thing from happening again. But yeah, this was done to me without my consent. And with the past history of bunches of things being done to me without my consent, without my say, this felt like the next logical explanation or escalation of what would happen. Of course this would happen. Why wouldn't it? Oh, okay. So having said that context of what happened and what I thought was going to happen, I'm going to give you the things that were done in order. Right, so we're with the surgeon, and the first thing they do is to get an idea of how bad the constriction is on the day of the surgery. So the flip is fed down into the esophagus, that lower sphincter, and inflated. And so that little inflatey balloon thing can tell you how much it's able to open. So that first measurement, my sphincter is not opening that well. The most that they can get it to open is 8 millimeters. They've never given me units on this, and I checked my notes and it's not there either. I think it's millimeters. Yeah, not great for food trying to get through. The average, I was told, is about 20. Rank-wise, the endo flip itself is fine. Under general anesthetic, so I'm not feeling everything they're doing, and I'm torn up enough from the endoscopy itself, so this is just in the noise. As such, the more conservative treatment used by my surgeon was a dilation, and I was told that they just do this with the flip itself. So it's a little inflatey balloon thing, and because they thought it's a stricture, you inflate the balloon enough, it tears the stricture, and so it can open. So they tore open my stricture and rechecked the opening to see how much of an improvement it was, and it could now open, my sphincter could now open to 12.1 maybe millimeters. Again, average is 20. Why they thought a little over than half average would be enough of an improvement is beyond me. This is going in D for dilate. Because again, this wasn't something I gave consent for. I wasn't told that this was a possibility of something they were doing. This was just something that was done to me, and the recovery sucked. It was a torn tissue structure, and so it was just sort of flapping, and food got stuck on it on the way down for probably about a week. So every time I ate, I could feel it. I could feel it, and food still got stuck because it didn't help. Double whammy, right? It hurts, food's getting stuck on it, and it's also getting stuck on the sphincter because it didn't solve the problem. D. I've heard the dilation is great for some people, and they probably knew what they were getting when they went into it, so it can be good, just not for me in this context. So after a bit of a breakdown, I was able to regroup and set about self-advocating again. And I became an annoying little bee in their bonnet that, hey, no, we're a week out from what you did and it hasn't made a difference. Food's still getting stuck. I need that surgery. It's not fixed things for me. And persistent, 2 weeks after, like, okay, fine. We will book you for the surgery. First available is 5 months out. So I had the extreme pleasure of having food continue to get stuck for almost another half a year. Anyways, for the assorted difficulties in swallowing associated with the various muscles in the process not relaxing to allow food through, the solution's pretty metal. You just cut the offending muscle. Problem solved. The surgery I had was the per-oral endoscopic myotomy, or POEM for short, and the recovery for this is fairly quick because it's done from inside the esophagus. So in this, endoscope and the various tools are fed down, and above whatever muscle they're going to cut, they cut into the esophagus, but not in the surrounding stuff. And then little space is made so that they can squeeze the instrument down to sever the muscle that is the problem. So the day of the procedure and in the pre-operation meeting with the surgeon, I'm sure my blood pressure and pulse were through the roof because he told me that if we see another stricture, we're not doing the POEM. I don't know what his plans were, but he wasn't going to do the surgery. And I was not pleased about that. In part because I proposed that it was the Botox shot that relaxed the muscles, let the acid up, and because the GI had me stop taking the omeprazole, that's what caused the stricture. I was told in every meeting with him or his team that no, it just wasn't seen. I'm a great endoscopic person. I see things. Maybe it was missed by the previous guys. I was told this wasn't possible. This wasn't possible. So I was freaking out. But bippity boppity boo, I'm in recovery, and like the first things out of my mouth are like, did they do it? Did they do the surgery? And unfortunately, the people there had no idea. Eventually, I found out that yes, they did it. They did it. And the surgeon popped by after to see how I was doing in the immediate recovery area. And after months of my proposed mechanism for how the stricture formed being rejected, suddenly it was the feasible explanation of things because no sign of a new stricture was there. Love me some vindication. So now with the surgery done over a year ago at this point, just barely, I can swallow things. I had no complications, but it's still gonna go and be. The prep and recovery was annoying. Going into it, you have to transition down to a clear liquid diet only. I think it was at least 4 days. It might have been a week. I don't remember. So you go down to soft foods and then liquids and then clear liquids. There's only so many clear liquid things you can consume for enough calories. And then coming out of the surgery, reverse it. Clear liquids, followed by soft foods, finally hard foods. And if things are going well, you get back to hard foods in a week post-surgery. And I was able to do that, and I had tacos, and it was great. And this is sad. I'm a person who generally likes Jell-O, or at least did. So for the first surgery, or for the first time I was booked for the surgery, I made myself this huge thing of Jell-O, and I was so stoked. And then things went pear-shaped, as they did. And it was a lot of Jell-O, so I would try eating it, and it just made me cry. Jell-O still makes me sad. So surgery was like, I don't know, Monday morning. And then after that, I was only allowed to have like ice chunks and stuff, and I stayed overnight in the hospital. And then the next morning, had to do another barium swallow to make sure there were no holes. You know, it's not going somewhere it's not supposed to. Everything's going down like it's meant to. And so kind of sucked because, you know, all I've had are just little ice chunks, and you have to do the barium swallow, the bariac swallow, and then you have to wait for it to be cleared by the radiologist before you can just drink water to get the bariac out of your mouth and out of your throat. And that was a huge ask. Okay, so you've had your POEM, you're given a couple months to recover, and then you are brought back for another endoscopy where they check to make sure things are looking okay, and they also install a Bravo. So the Bravo TM is this little device that is installed in your esophagus and measures the pH levels for 48 to 96 hours. I was lucky enough to do the 96-hour version. My husband also had to do this because of his acid reflux. They wanted to see what the situation was. So there's a little capsule in your esophagus, and it is transmitting data to this little wearable that this guy's wearing that has a bunch of little buttons on it. So you need to indicate when you're eating, when you stop eating, when you have acid reflux and like when you're laying down or sleeping. Also, you need to raw dog your acid reflux treatments. The only thing you're allowed to take in the week before this and then during is Tums. That's it. And I have found that omeprazole is pretty critical in my overall antacid package, so this was brutal for me. But pushing the little button on the wearable isn't enough. You have to keep a log where you basically verify or back up all the things you're doing. It's time to start eating, time to stop eating. I have acid reflux now. 15 minutes later, I still do. It's a lot, and I understand why you have to do this log. You know, if something goes weird with the data collection, they have a backup and it's not complete waste. Or if you forget to push the button. I did that a couple times. It happens. And the stupid wearable beeps if it gets too far from the Bravo capsule and the range isn't fully enough to do something like shower, because you're not supposed to get it wet, but you need to keep it close. So if you get too far for too long, beep. And it also beeps quite loudly if it wants your attention about something, if it feels lonely, if it hasn't beeped for a bit. Like sometimes it would just beep. It was sitting on me and I don't know why. Can you tell this thing annoyed the crap out of me? As such, the Bravo's also going in B. I didn't feel it in my throat. My husband did. I didn't somehow, but just the whole drama of the situation was tedious. And at this point now, my digestive journey is just maintenance. I can swallow, no problem, but am experiencing acid reflux for the first time in my life, really, because my god-tier sphincter is no more. It was a worthwhile trade-off for me. Pelvic stuff. The bulk of this section is going to be for a pretty specific pain I've had for a couple decades now in some form. It is right down the middle, right in front on the pelvic area. And I say in the front because, again, AFAB bits, period cramps can be elsewhere. This is right in front. It's sort of like if you did the suck it gesture, but with one hand right down the center, angled straight down. So nothing like the suck it gesture. The first time I experienced this, or at least I have a vivid, clear memory of, was way back my first year in grad school, winter break. And of course, with the timing of things, it happened when the student health center was closed and I had the student health insurance. And since it was closed, my other option was the ER and I didn't want to find out how much that was going to cost. So called the nurse hotline that was on the insurance card and talked to a nurse there. Told her okay, I've got this pain happening, described where, there's an increased need to pee, increased frequency, not seeing blood. Because of that, she was like, okay, well, try some cranberry, and if it gets worse or you start seeing blood, go to the ER. Anyways, not quite a decade later, I got hit with an intense pain there. So it wasn't just an ache, it was ugh, bend over, I can't breathe, I am in so much pain. It could happen while I'm walking, it could happen, unfortunately, while I was teaching, it could even happen during sex. And let me tell you, that absolutely kills the mood. But still, there was no blood, there was nothing scary happening, so just started doing cranberry again. After my husband's postdoc, we moved back to the US, and through a convoluted series of things, I ended up with my primary care practitioner being an RN. And I call this guy my doctor nurse because, yeah, he was an RN, but he was honestly better than some of the doctors I've had. The shortest version I can manage. We're living in the middle of nowhere because my husband's there to babysit an experiment. And middle of nowhere, healthcare options are limited. But I find an amazing doctor. He's the guy who listened and diagnosed the trigeminal neuralgia after too many bad experiences. But he was a little too thorough with each of his patients, and so he wasn't getting through patients quickly enough for those who held his contract, so it wasn't renewed. The other two doctors in town refused to take me on as a patient because too much stuff wrong with me and they don't want to be writing my prescriptions. And eventually, at this little healthcare clinic, like a community clinic, this nurse takes me on. And part of the pain medication contract I have with him is I have to be tested for drugs monthly, like to make sure I am on what I should be and not what I shouldn't be. So I'm having to do these monthly urine screens anyway. I mentioned the pain stuff because it's still happening. So 1 month, we test it for other stuff too. It's a urine test. You pee in a cup and they test it. So for drug screens, they don't really care about bacterial contamination. So whatever. But if you're doing something for like a UTI, you have to decontaminate the area before you do the whole pee in the cup thing.
Good. Yeah. Good job. Good job. Yeah.
Admittedly, my OCD might be dragging down the ranking here a bit, but I'm putting it in B, even though it is a quick, relatively easy thing to do. I don't like the process and juggling it while trying to wash your hands, and also gross. And also the process of taking it to wherever it needs to go with the warmth and pee of it all. Gross. B. Then sometimes you will have to do a 24-hour urine collection thing, like when the worst psychiatrist you ever have messes up the code for a thyroid test and you get to collect your pee for 24 hours. Gross. That would be down in C. They didn't see anything in the urine, so I let it drop until the pain came back, let the doctor nurse know, and he put in for me to have an ultrasound. Of course, this being the middle of nowhere, the only place to have it done is an hour away. And there's sort of a hub for a lot of people, so it was booked out for a couple months. So of course, by the time I get in there, pain's gone. So ultrasounds use high-frequency sound waves to mostly map out organs and other soft tissues, babies included. And it's non-invasive, non-ionizing, which is a plus. You can kind of think of this like medical echolocation. Sound waves are put out by that little wand, the transducer, and they bounce back at different rates depending on how close it is to that source, the transducer. And so the sonogram, the picture, the video that you get of this thing, is a representation based on how fast things are bouncing back. This is going in A for me, somewhat for anxiety again, because you have a stranger applying goop everywhere, and the goop takes a lot to get off. But then they're just probing away at your pelvis, and it's weird. It's weird. And then the goop doesn't come off, and they hardly give you anything if they even remember to, so you're using like the hospital gown and the paper thing that you sit on, and it's still just goopy. Gross. Would you believe it? They didn't see anything in the ultrasound. But eventually, pain came back. Next step was a CT scan. CT scans, which used to be called CAT scans, although now they're typically called CT, or at least that I've heard, are sort of like a cross between X-rays and MRIs. So they're using X-rays, but from like 3 dimensions around you to build up a detailed 3-dimensional model of what they're looking at inside you. This was also done with a contrast agent, which involves an injection while you're in there. So first, they do the normal scan, and then they inject you with gadolinium, which shows up differently in the X-ray. It highlights blood vessels or inflammation in the CT. So they put you back in with the gadolinium in your system and do another scan, and from that, they're able to see sort of concretely where the blood vessels, inflammation, and other little things like that are. This, solidly an S for me. Yes, there's ionizing radiation in it, but it's over fast. Even with the injection and having to do it twice, I was out of there inside of 20 minutes. It's great. And with that, there's nothing left to say here until the conclusion. They didn't find anything. It felt like nobody was going to find anything. And yeah, just this is some pain thing I'm going to have to deal with until I die. Unless something changes. Something happens.
Sometimes foreshadowing is relatively obvious.
Neurological. Oh, next chunk, and this is quite the chunk. You can tell from all those little dots indicating all the slides here. And some of those are animations, but there's a lot to talk about here. There's a couple distinct chunks, and inside of each of these, we're going to be working chronologically. We're going to start with the big one that kicked off the recent medical journey, at least as far as this channel is concerned, trigeminal neuralgia. The short of it is you've got 3 main branches coming off the trigeminal nerve that serve your head and face. The ophthalmic nerve serves the top front part, the maxillary nerve serves the sort of middle part, and the mandibular nerve serves sort of your mandible area. That nerve can get compressed or irritated, inflamed. In my case, seemingly hexed by somebody I did wrong in a past life for as much of a concrete answer as I can get about what's causing mine. But whatever the case, having that as a baseline means that pain can be pretty easily triggered along the nerve. So that nerve pain can result from brushing your teeth and hitting something you shouldn't have, physical touch, even sometimes just a light breeze, poor sleep, pressure, looking at it sideways. So there's a couple types, like type 1, type 2. Type 1, you'll just have these intense stabbing pain periods that are pretty short but can recur. Type 2, you have those on top of a constant pain component. And the constant pain component for me at this point feels like a cold burning, like if you hold an ice cube and then the intense pain flares. It's lancinating, like it feels kind of stabbing and it pulsates. So when it's going off, it's like it turns on, dirk, 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 dirk. I think the most I counted when I could count it was 15 seconds and then it turns off. Sometimes for as long as a minute and then back and then off. And it just cycles through that for a while. When the pain flares first started happening, I didn't have the constant pain component yet. It would happen, it would trigger and last a couple hours and then resolve and be fine for a bit. Eventually that turned into many hours, which eventually at some point became a day and a half, 2 days, until I finally said like enough, went to the ER and the ER doctor took pity on me, gave me a morphine shot and went off prescription for Dilaudid. So the shot and the medication did help. It broke the flare like instantly. And as I ran out of the medication, it settled back in with that constant component and the flares on top of it. So the constant component for me, if I have no medication whatsoever, hovers around a 4 or a 5, give or take 1. And with the level of pain management I have now, get down to a 3, give or take 1. The original level of pain management I had, it would be about a 2, give or take 1, but bad things happen, I guess. So those flares, in total honesty and disclosure, transparency, on this scale, with those criteria, it's a 9. I have trouble thinking, speaking, doing anything. Like there's only the pain and there's only me existing in that pain space while it's flaring. It's awful. And it goes on for hours when it's fully going. But you tell a doctor this is at a 9. In this country, odds are they're going to think you're drug seeking. It can't possibly be that bad. So the most I will say is an 8. Even though, like, one of the times I went to the ER in the last country we lived, I forgot my address. You know, I'm checking in, they need the address, and it's like, I can't tell you. It's on my driver's license here. I'm sorry, I can't. You know, it can trigger pretty easy, like if I touch it wrong. Those tend to be over relatively quick, but there's a couple times in the year where it'll just be awful, like a hair trigger to set it off for hours, if not over a day. And that tends to happen in the major seasonal shifts in temperature. So going between summer to winter, it happens. Like I'm coming into it pretty soon, I think. And then going back into the warmer part of the year. That's another inflection point for this. And I'm guessing it's going to be happening soon because other symptoms coincide with it, like increased dizziness and poor coordination. Like the dizziness is a separate thing, but just really bad coordination, some shakes and spasms I'll talk about. Just all of it has an uptick around the same time. it seems like it should be diagnostically important, but kicking off the treatment tests and procedures for this, during one of the early flares in grad school, I rolled into the student health center, like looking for help, as you do, and they did the otoscope on me. And this nurse was not gentle. Like, it hurts no matter what at this point. But she was just digging around in there, and generally, I'm not one to try to show pain or really react, as evidenced by what I said about the IUD. I was bawling by the time she was done. It was bad, and she just made it so much worse. So, yeah. And the audacity of this woman, her diagnosis for me, after digging around in there like she did, that I had a pimple in my ear, causing me the most intense pain in my life. It was a pimple, because, pimples can really hurt sometimes, This thing? C. If somebody does this to me when I'm in pain, I am not zen like in this picture. And if I'm not in pain when that goes in, I'm in pain when it comes out. The sex one's going to be weird, but let me explain. So the next test that was done for this was an electrocardiogram, which is commonly called an ECG or an EKG. It's the same. And this was done because extreme pain in this area can signal a heart attack, especially in like AFAB people. So I get it. It's weird, but I get it. So with this, you're hooked up with a bunch of electrodes, and they measure your heartbeat and can tell a fair bit about what's going on with your heart, on how things are different between them and what the signal itself is doing. This can be done in a medical office setting, or you can be given a portable unit for longer periods of time, like if your heartbeat isn't going below 130 beats per minute for several months. At this point in my life, I don't know how many times I've had this done. It's just standard operating procedure for me at this point, because rolling into the ER with the pain, it was done a couple times, which fair enough, again. The heart thing, and every time you're put under general anesthetic, it'll be done. Which, as you might be figuring out, is far, far too many times for me in the past couple years. I'm putting this in A. The test itself doesn't hurt, and you're not poked or prodded or anything, but little stickers, or being pedantic here, little stickers, either they hurt removing, because it's like peeling off a Band-Aid, or, and sometimes you're left with like the adhesive on you, and it can take a bit to come off. And if you're not feeling great, like you're coming home from having H1N1 and your heart rate's through the roof, trying to get rid of the adhesive isn't a top priority. So the shrug I eventually got about this in grad school from the health center was, maybe it's TMJ, and then self-advocating to try to get a referral for whatever specialist would see that, and that's weird. Normally we would be able to send you to like an ear, nose, and throat doctor, but TMJ is kind of carved out as being an exception. So between that, how much my hospital stay cost me, and how terrible the health center was, I didn't have insurance until we moved to a country with socialized medicine. But, that started during my husband's postdoc, and with where we were living there, the socialized medicine system was stretched beyond thin, and I was on the wait list for a GP the entire time I was there. A friend got fast-tracked because she got pregnant, which, fine, I guess, but I never got a primary care person. So my care options, as was the case for many of the people there, was either urgent care or the ER. And urgent care had pretty limited hours, like 7 to 4 on weekdays. And the ER was 24 hours. Those were your options. And the lines at both, like people would line up at the urgent care an hour early to try to get in there with less of a wait. So during one of the lengthy flares that happened before the big one that lasted over a day, it was going on long enough that I went to the ER to see if they could help me. And after giving me the EKG to make sure I wasn't having a heart attack, I got to wait for 12 hours just in a chair because they were so full. A lot of people, if you weren't like bleeding out, you got to wait in a chair for them to give me an intramuscular shot that was basically ibuprofen. Intramuscular shots, especially like for ketorolac or Toradol, whatever it was, basically ibuprofen, is done in your butt cheek because there's a nice big muscle back there for them to inject it in and for it to gradually do its thing. The shot sucked, both in terms of how little it actually does for me, because ibuprofen doesn't touch this. I could have told them that if they'd asked me, but of course they don't. And also the injection site, because it's a big shot in your butt cheek and it hurts after. It hurts to sit, it hurts to walk. Maybe it's worth it if the ketorolac does something for you. It doesn't. And it also got to be a painful little reminder of this whole experience of the 2 hours waiting to get into the back, plus the 12 hours waiting only to see the ER doctor Googling vague pain in jaw, and then to come back and tell me it's nothing, here's a shot, bye. C. Since I wasn't getting a GP, but I did have a dentist, because dental insurance isn't universal there. I asked my dentist for suggestions, and he referred me, or just sent me, to a physiotherapist who did do physiotherapy with people, like they were on machines and stuff, but he also did other things too. One of those things, and there's an assortment, don't you worry, one of those things was chiropractic medicine. And he didn't tell me this is what he was doing, but it's what he was doing. I know this because it's not an experience you forget. What he did was gloved hands and then put them in my mouth and started massaging the back portion. You may recall that I said that touch can set this off. Yes, exactly. He set it off. He set it off bad, but he kept going because you don't stop. This is a healing process. I know this is chiropractic because I was watching various people talk about the woo that is chiropractic medicine and adjustments and all of that. And hey, look, here's a weirdo putting gloved hands in a woman's mouth and rubbing exactly like this guy did to me. Great. Now, the one shred of charity I'm going to give this guy is he was working with the assumption it was TMJ. I will give him that. So with that combo of physical touch setting this off and just it being chiropractic medicine being done on me without telling me that's what he was doing, D. Oh, wait, he doesn't just do chiropractic, he also does acupuncture. Because of course he does. So this one he at least asked, let me know he was going to try acupuncture before he stuck the needle in. So, yay. And also, it was a brilliant moment of foresight that I said yes, despite my better judgment, because turns out in the subsequent years, I would be asked many times, did you try acupuncture? Because that can really help people. It actually made it worse in my case. It's the weirdest thing. I have an irritated nerve, and sticking a needle in it continued to irritate it. D. This guy was a one-stop shop because he also did ultrasound as a treatment. It is thought that ultrasound can be done as a therapeutic approach for TMJ because putting in the ultrasounds will somehow improve blood flow, thereby improving the TMJ situation. Maybe it would have helped me if this was actually TMJ or a muscle issue. But it's not. So fine, this one gets to be up in C. I'm not entirely sure when this one got brought up, but I'm pretty sure it was while we were in that country. Good old guided relaxation and meditation. Mind over matter. Think your pain away.
More and more, I can consider the possibility that my body is teaching me something useful, that this pain is strengthening my heart and my mind.
That is from a video I have where we went through a guided imagery CD I was sent by a former insurer, Blue Shield, because, yeah, doctors in that network weren't entirely interested in treating me. So I got sent that instead. It's a sort of consolation prize. And fine, sure. Guided imagery might help some people with the pain they're experiencing. I am not one of them. And despite all the fun little laughs we had in that video, doesn't make up for all the anger and frustration I have being sent that as a legitimate alternative to adequate pain management. This one is a D from me, dog. But in this process, I do get more MRIs done. Kaiser, Blue Shield, and current insurance, Aetna, all of them have done MRIs of stuff to see what's going on. The MRI I mentioned earlier for my back that got the high score, that's the only one I've gone in feet first. Everything since has been head first. Machine's the same, but the setup's a bit different. Like, this is almost certainly for like a brain or a head scan, because you are put in this little cage so that you don't move your head, and there's a bunch of pillows and stuff wedged in. Yep. So they wedge you in there good and proper because they need you to hold still for at least 30 minutes, if not an hour. Like all of the brain head scans I've had, we have been an hour, and they're also doing a contrast. So there's the first part without contrast and repeat it. So these started off being done for the trigeminal neuralgia to make sure there wasn't like a tumor or something super gnarly in there. There's not. But they've also been done for the next problem we're going to talk about. And with that, we are leaving the world of trigeminal neuralgia and entering the world of a mystery problem. So this mystery problem is actually 2 mystery problems, but we're lumping them in together because the tests were sort of all done at the same time, kind of. So first component are muscle spasms and twitches. And my dad had Tourette's and described his tics as something that he could feel coming on, kind of like you're suppressing a cough. He could feel it. Whatever I'm experiencing just comes out of nowhere. And so these are in my head and face, and mostly dominant hand, but it also happens non-dominant hand. So both arms, I guess. And these aren't huge. It's like fine motor detail, at least for my hands. And the face stuff, it's like usually small little adjustments. I've probably been doing it a bunch in this video up to now. I also have recorded videos because producing these on command for doctors is impossible. So the twitches and spasms are more distressing for me than the numbness, but the numbness generally catches the attention of the doctors more. And the numbness is the strongest on like face, head, and like my right arm. But it can also spread out to my whole body, especially when I'm more tired. The twitches and spasms started in my mid-30s, at least at a noticeable level by me. And the numbness actually started in my 20s. The scans this time were looking for the lesions associated with multiple sclerosis, or MS for short. So I was sent in for a head and then a cervical and thoracic spine. This was originally supposed to be 1 appointment, then they were like, no, we can't do it in 1, it's gotta be 2. So they did another brain scan looking for those lesions, and then cervical and thoracic spine section looking for problems. Each of these scans was about an hour, and it was with the contrast, so you have the without and then with, again, for the head, and then the 2 sections of the spine they did. Now, I'm somebody who's generally pretty good at holding still, because you tell me to hold still, I'm gonna do my damnedest to hold still. And I'm generally not claustrophobic, especially if I know that escape is easy, but by the time these sessions are over, I am ready to come out of the tube. Especially like, this one, it's not too bad, but on the spine section, I noticed that I was getting pretty warm. Pretty warm. And I was thinking about how MRIs work, that they're oscillating the hydrogen atoms. And then I thought about it, and microwaves work by doing something with the water molecules. I might be getting lightly microwaved right now. I know I'm not in danger of being cooked, but wasn't a great thought to have 30 minutes into one of these. Like, So this is going in B. Like, it's fine, but, they're long, they're loud, they're tight, they're warm. If I was less good at holding still, I'm sure I would rate these lower. True story. My husband had a MRI done on his knee once, and he probably has restless leg syndrome. Like, he's got to move. He was trying to hold still, but they sent him home with a prescription for 1 Valium. Come back after you take this with the driver, because he could not hold sufficiently still for them to do the MRI, and it was just a quick one. Imagine if he had to go in for a brain scan. They'd have to like sedate him. So it turns out my brain does have lesions. They're not the ones that are associated with MS, but I do have lesions. Their best guess is they're associated with migraines, because apparently migraines do that. So those scans were basically the last things done by a neurologist I had under Blue Shield. We switch insurance to basically Aetna. It takes a bit of doing, but eventually I get in with a neurologist. She's amazing. She's an hour away, but she's amazing. She's thorough. She listens. So she was most concerned with the numbness. The twitching took a bit to get her back on task with that one, but she wanted to make sure that the numbness wasn't caused by like a degenerative nerve condition like amyotrophic lateral sclerosis, the thing that people were doing the ice water bucket challenge for. So you have the central nervous system and you have the peripheral nervous system, and stuff out in the periphery can be categorized by their size and their function. So at this point, we're checking all the nerves in the periphery, more so the larger ones, but just checking everything. The way we do this is a pair of tests. The first of these tests is the nerve conduction test. And so with this, they measure how your nerves be conducting. To say it a different way, they measure the speed it takes an electrical signal to travel down your nerves, because the speed of this is pretty consistent between people. So if it's slower, that's not good. That's indicating something bad. So as in this picture, you're wired up with some electrodes so you can tell when the signal gets there. Where's this electrical signal coming from? They basically mildly electrocute you. No joke. I accidentally once touched a taser, long story, and it was similar, minus the surprise element. Technically, pedantically, when I had it done on my arm, wasn't the first time I had it done. That was actually on my face when we were trying to figure out my nerve stuff by the worst neurologist I had. Like, I've had some terrible neurologists, but he takes the cake. This is somebody who argued with me about the carbamazepine causing thrombocytopenia. Like, nah, you're not Asian. It doesn't happen. Showed him the blood work. Oh, that's weird. Don't argue with me about this stuff, guy. Yeah, so let's do a nerve conduction test here, even though my pain is here. Let's do it here, but let's not do it by the neurologist. He's too important. No, let's have an unsupervised tech do it who's never done it before and is just trying to read the manual and figure out what to do. This is like one of those things, going off script a sec. I feel like I've had such terrible experiences, and sharing with people, I do get like, you're kidding. What? But guarantee in the comment section of this video and all the previous videos, it's a horror show. Like, I'm not an outlier. I'm not average, but I'm certainly not well above average. I just have a greater cross-section of incidences where I have more stories. Everybody has terrible stories. Everybody. Anyway, when appropriately done by people who know what they're doing, I'd say this is about a B. It's a little unpleasant, but it's over pretty quick and doesn't leave any lasting damage. So the other half of test done was the electromyography. So the previous one looks at the speed of nerve conduction. This one is looking at the firing activity of muscles. And this picture is kind of underselling it, because you know how you check the firing activity of muscles? You inject a needle into the muscles you're looking to measure, and then you strum them while the electrical signals downstream are measured. Strum. We are strumming. Strumming like you would a guitar with a pick. That's being done to your muscles with a needle. And this was done in my arm and in my leg. So this was worse than the nerve conduction test for sure. Absolutely better than the manometry. But how much better, how much worse? Oh, I'm gonna say C. Because again, no lasting damage, and it sucked while in there, but as soon as it was out, it was fine. So C. And both of these tests came back fine. So nothing scary, degenerative happening. Yay. But there's one final thing my neurologist wanted to check. These tests show that the large fibers are fine, but what about the small little fiddly ones? Don't forget about them. Mayhaps some of my weird problems are caused by stuff going wrong with them. So the last test from my neurologist, was a skin biopsy for small fiber neuropathy. Neuro meaning nerve, pathy meaning disease, and small fibers being little fiddly nerves that innervate the skin and some of the organs and support sensation and also some autonomic functioning. As shown in this picture, a series of hole punch biopsies are done. And it's like they go in and take out a little plug of everything. It's kind of cool. Series of them are done above the wrist, on the thigh, and on the foot. And these little punches are looked at under a microscope to check these small fibers, see if there's something bad going on with them. And neuropathy would be indicated by problems, disease in those nerve fibers, especially if it gets worse the further out you get from the central nervous system. Given the depth that they have to go in, this is done in a full sterile situation. This was like the first time I've witnessed this happen, so it was a bit unnerving because they do go in deep and they don't close it necessarily. It's something that'll close up on its own. But in the first day, you are very specifically instructed, do not get this wet. No showering on it, no submerging, and no submerging for 3 days. So this was a not great timing for the weekend because right after I had this done, the day after, a good friend and her boyfriend visited, and we did a lot of walking, a lot of sightseeing, and went to the beach. Where I just had to sit there and not go play in the water because I couldn't get my foot submerged. Lame. The punches themselves were made with a local anesthetic, and the healing process was fine under more normal situations where I'm not just walking the entire weekend. I'm sure I'd rank it higher, but because I was having to put a shoe on and off for 3 days, it kind of hurt, so this is going in B. If it was a normal, working from home sort of situation, I'm sure I would have put it in A, but it hurt with the shoe. It sucked with the water requirements, so B. And all these tests didn't find anything. So huge medical shrug for what is causing all of this stuff. Like I said, there's a lot of categories here. Next up, we've got recurring dizziness, because it's fun to be me. So with this, specifically the dizziness, because there's also like what I'm going through right now where I'm a bit not coordinated, like I just almost stabbed Toby with a pencil, bumping into things and a bit not great. That's different than this. The recurring dizziness is very specific and it hits hard, it hits fast, and lasts for up to a week. And it's not dependent necessarily on what I'm doing with my head. It's just kind of all the time. And other than the otoscope, so the ear looky anything, no tests have been done on this. Just years and years and years of people looking in there, not really seeing anything. Maybe you have an ear infection I'm not seeing, but I don't want to give you antibiotics for it, which could. But maybe try some allergy medication to keep things clear. Oh, you could do the Valsalva maneuver. It's been a while since I did that. See if that will somehow make the dizziness better. You can do these head movements because we can pretend it's benign paroxysmal positional vertigo, which I'm just going to call vertigo for short. I've been at this a while. Right. So in your ear, you have these semicircular canals, which are these series of tubes with fluid in them and little hair cells and these little crystals. And so when you move your head, the fluids spin, and that sort of helps you know where your head is in space. Those little crystals can sneak out from where they're supposed to be, and when that happens, you get vertigo. But there's a series of head movements, the Epley maneuver, that you can do a couple times a day for a couple days that should get those naughty little crystals back where they're supposed to be. But with this type of vertigo, if you're not moving your head, you don't really have the vertigo experience. It should calm down substantially at the very least. That is not the case for me, but they still have me doing this stupid head procedure. So this head movement procedure is going in C for me. I'm sure they are very helpful for people with the appropriate type of vertigo, but for me, doing these head movements, it's not even that it does nothing. It makes me feel so terribly awful. Like, it makes the dizziness substantially worse, and doing these head movements can trigger this stupid thing. So now I'm super dizzy and in pain. C, at the very best for me. So the good neurologist happens to have a good connection with an ear, nose, and throat doctor. She sent me his way. He asked me a series of questions, and yeah, no, these sound like vestibular migraines. You can try a migraine abortive to see if that helps. Because it turns out that migraines aren't just pain or auras or that stuff. Although vestibular migraines can have an aura component, and it's weird. It's like, feels very Alice in Wonderland-y. And I can tell, like, okay, I'm going to need to take the medication soon because I feel small in the house, or I feel big in the house, like walking down the hallway. It's weird. It's surreal. But that is the aura associated with vestibular migraines. The thing I forgot to mention is these can be associated with changes in hormone levels. And mine, almost without fail, happen the week before my period starts when progesterone levels are increasing, decreasing, increasing. So yeah, my hormones be messing me up again. The second to last neurological problem of mine at this point, because who knows what else is going to come down the pipe. I wish I had a better description of it. My brain feels sunburned. Like under my scalp, because that has been sunburned many times. Under my scalp, the surface of my brain, it feels sunburned. So this was something that started relatively recently in the grand scheme of things, a couple years ago instead of decades. But it was gradually getting worse with time. And right before we tried the next treatment we're going to talk about, it was pretty bad. Like, it was starting to border on occupying my thoughts. It was that painful. And also, like, putting my head on the pillow, trying to fall asleep, made it worse. Like, so much pain would just be boiling up. So what I had to do was basically try to stay up as long as I could until I'm passing out wherever I am, and then go to sleep and hope I fall asleep fast because the pain was so intense. And also, I couldn't dilly-dally in waking up. Like, if I woke up and I didn't fall back asleep right away, I had to get up. Doesn't matter how tired I was, I'm not going to be able to fall back asleep in that pain. Given all the MRIs and assorted tests I've had, this territory is pretty well mapped out. And so, reasonably, I think my neurologist assumed there was nothing weird causing this. Although I did have to remind her that, hey, this is a problem. Can we please do something? So she referred me to a headache clinic for a nerve block to see if that would help. And wouldn't you know it, this headache clinic rejected me as a patient. Now, this neurologist, she writes very compelling letters and referrals and everything. Like that migraine abortive I mentioned, it's not on generic yet. Like, it's only name brand. If I buy it without insurance, it's like $1,000 a month for 10 pills. With the tiering pricing structure of our insurance, because it's only 10 pills, I get that for free because she got them to authorize, or the prior authorization went through. She's that compelling of a writer. And this headache clinic rejected me and neglected to tell her or me and just sort of let it slide. She was surprised that this happened, that they rejected me, that they didn't let her know, where it's really par for the course for me. Like, I even thought to ping her a week after she told me to, because these things happen. I was expecting them to have lost a referral, but, you know, rejecting me as a patient is also pretty likely. Anywho, undeterred, she instead sent me to my pain doctor to do it, and so he did the occipital nerve block. And in this, it's interesting. A steroid and an anesthetic are injected into the base of the nerve, which is like back at the base of the skull. And to make sure that they're getting the needle placed appropriately, it's guided with ultrasound. So they're like juggling a couple things. It's a bit awkward, but you know, it works. There's an immediate numbing effect from the anesthetic, and then the steroid helps ease things out, and hopefully you will experience some lasting relief from this. And yes, I do experience some lasting relief. It seems to last 3 months, maybe 4 months, but the process, so they inject in, and given the placement, because it is like base of your skull kind of situation, it feels like they're having to punch through a bunch of really hard stuff to get to the nerve. And then when they're injecting it, it feels like they're just inflating this massive space. It's helpful, but ugh. And then for me, something that's I don't like is the numbness. Like, granted, the reprieve from the burning is great, but for the first day and a half after, both times I've had it done now, it's numb, fully numb, but like I still have sensation from like my hair doing stuff. And so it doesn't feel great. Maybe with time I could get used to it, but then also the combination of like superficial sensation and the deeper stuff, whenever my head is on a surface, it feels like I must be shoving my head into it with, I guess, just how the difference in signals processed by my brain. And it's just, So altogether, I'm putting this in B. It's fine, but there's just a lot of about it. And like so many other things, no idea why I'm experiencing this. We're not going to try to solve that mystery, I guess. Fine. And the last of the neurological things I've got going on for now is a very specific, very intense pain I get in one spot right there. Just right there. It's like a little singularity of intense pain. It comes and it goes, and I wish I understood the triggers better. As with the other things, it happens easier coming into or out of the different major halves of the year. But it also happens when I'm working at my desk. Definitely happens while I'm filming videos. Can happen while I'm exercising, while I'm stretching, while I'm sleeping. The only time that really seems to give me a break from it is when I'm reclined. That's it. But there is no such thing as free lunch, right? So if I'm reclined for this thing, I can be making the occipital and the trigeminal neuralgia worse. Like, I can trigger pain things, flares, if I'm reclined. Like, part of the whole terrible experience of the endoscopies for me is they tend to recline you while you're waiting. And it's like, please no, can I just sit up? Please, because this is triggering this. The longer I sit here, chicken bomb is just getting ready to go off. And then, they put the thing in and it's absolutely going off. But sometimes it can go off before I'm even in there. So prior to the next treatment we're going to talk about, and also for the occipital neuralgia treatment, my MO of working would be to be at my desk, writing or editing for as long as I possibly can until this gets to be too intense that I just cannot continue anymore, because I will reach that point, is a singularity of pain. That happens, I retreat to my poof, because I have a poof, and it is very nice. I have a picture of Max in it, and video of him in it, because it's nice. I don't blame him. Retreat to my poof, and vibe there until this pain becomes so intense that I have to be upright and keeping my head off of things and potentially holding this, and just back and forth between, okay, now my rib pain's too bad, I have to go back to this. Okay, now the other pains are too bad, so I have to go back to this, and just sucks. Anyway, we were talking about this pain, and so brought it up with the pain doctor on one of the follow-ups with him, and he suggested I try lidocaine patches. He wrote me a prescription for 4% because it needed to be 4%. Walk into the pharmacy and they're like, no, it's just on the floor. Go get it. The on the floor price is something like close to $20 for not 20 patches. These things are expensive, but they do work. Kinda. So if you find yourself with some sort of back pain, I will say that they do work. They do work. But they're kind of expensive, and you need to make sure that you get the 4% lidocaine version. At least in the Walgreens I go to, the way these are on the shelves, there is woo. Just bookmarking it. You need to make sure you're getting the right thing. So these are useful in knocking this pain down into something somewhat more manageable. I'm still going to put this in B because these, like this spot, I mean, I'm even sort of kinking my neck showing this. Putting a patch here by myself is hard. They like to stick to themselves. So pretty much every time I put one on myself, I mess up my neck. Also, they're goopy. They're goopy. Like when you take it off, you're going to have goop. And if you get a generic version, because they are cheaper, less effective, less nice, the goop oozes out from the sides of the patch, whereas like the name brand version, like Salon Pass or something, doesn't. It stays more under the patch. So it's a bit of a mess. An expensive mess. So having already done one nerve block and feeling that these patches were helpful, but wanting a more long-term solution that potentially would be less expensive, I asked my pain doctor if a nerve block for this would be on the table. And yeah, it is. Well, it was booked out many months in advance. So the occipital nerve block involves walking in, walking out, and making sure you have a driver because they can make you dizzy. Like, I need help walking to the car because I have lost vertical altogether. Kind of how it feels where it just, I lose where vertical is, and so it's easy for me to just tip over. The intercostal nerve block, whole other level. So the prep I had to do for this doesn't have prep. It's just like show up on time. The prep I had to do for this was the general anesthetic prep. So stop food at midnight, no liquids 4 hours before, which sucks for a reason we'll talk about in a bit. But yeah, apparently this was a just in case sort of situation because some people will need to be put under general anesthetic for it. I was not. I was just given like the little local anesthetic while they did it, and I was fine. However, part of why this is a bit more intense than this one, weirdly, is given the close proximity to organs like your lungs, first they do an x-ray to get good visualization of your ribs and the organs and stuff. And then the needle injection is placed with an ultrasound, as is the case with the brain. And I am warned that, we could go too deep, we could puncture your lung, we could hit something else, and that would be bad, and then we would need to inpatient you and fix it. Why I haven't gotten these sort of warnings for up here? I don't know. Seems weird. Whatever. So this type of nerve block is gonna go in B. One, because I'm a night owl, so doing the general anesthetic prep sucks. I'd still be eating and doing stuff after midnight, but now I can't. Lame. More importantly, the way they had me positioned triggered the trigeminal neuralgia bad. So I wasn't just upright like this guy. They had me sort of on a massage table situation with my face in one of those horseshoe things, but and with the oxygen, they had me on room air, but triggered it. And the tension of having to hold my arms a certain way because I had an IV in, it triggered. I flipped back over and I was crying and they were like, oh no, what happened? It's you triggered this. It's this was fine. That's fine. This isn't. But pain management can be a bit more direct in the hospital. And so, I got a shot of the good stuff and, that aborted the flare process for the rest of the day. And that is very much appreciated. And as is the case with almost all the other neurological stuff, why this is happening? Don't know. Is it going to get worse? Is it going to increase in size? Am I going to get other spots? Who knows? Who cares? I care. Miscellaneous. Last big thing to talk about is basically my immune system. Specifically, how is it attacking my body? Right now, my diagnosis is undifferentiated connective tissue disease disorder by my current rheumatologist. And undifferentiated can stay that, or it can differentiate into one of the other autoimmune conditions. I am sitting on that diagnosis because I have a patchwork hodgepodge situation going with everything. I have some symptoms like heat and sun sensitivity, which I think is generally lupus, Raynaud's, which is sort of like a cold sensitivity, and I'll talk about the specifics of it later. But it can result in gangrene if I really mess up taking care of it, or blisters if I'm more careful but still human, and autoimmune antibodies that don't match the symptom pattern, at least as far as my rheumatologist is concerned. And those antibodies are the only part of these symptoms that have been tested in any way. Everything else has been report symptom, get diagnosis, or it gets ignored. In the medical limbo video, I hadn't seen my rheumatologist yet, but something I felt generally stuck with was a general propensity of some healthcare practitioners to treat you like you're imagining things or malingering if the test comes back negative. As I said probably an hour ago in this video, things have largely improved on that front. The GP I had at that time found she didn't like general practice, I guess, and switched to gerontology, and my new GP is pretty chill. Perhaps a little too chill. It's fine. My neurologist is amazing. My pain doctor and I seem to have reached an understanding at this point because it was kind of dicey at the start. And the GI team is substantially better than the ones who referred me to him. Things are largely good, except with the rheumatologist. She's very much of the philosophy or mindset that if the lab work isn't backing up a diagnosis, she's not going to risk treating it. Like, risk was used in her phrasing to me and my husband asking why something was being done. This is especially maddening on a couple fronts. Like, I keep reading forum posts from people with various autoimmune things who themselves may be seronegative, so they don't have biomarkers for things, like the blood work comes back negative. So seronegative, but their rheumatologist tells them, I'm here to treat the patient, not the blood work. Where can I find one of these doctors? But also because I keep reading about the medications that are used to try to treat the existing symptoms and prevent things from getting worse. And my doctor's just like, no, I don't want to risk it. No. In hindsight, it seems like a lot of the problems started happening roughly around the same time. So the trigeminal flares only really started in grad school, but towards the end of undergrad, it was getting painful to wear headphones. And so I just started, like when I was working in a rat lab, brought a speaker in because I couldn't deal with wearing the headphones. It was giving me a weird headache It was that. The not UTIs that started in grad school and a little bit later in grad school still, I would get these weird pains kind of back here. So I thought, maybe I have like a nutrient deficiency or something that's causing a problem here. Try some vitamins and eventually it would go away. So maybe that was solving it. My hands were always cold, but aren't all women's? That happens to everybody, right? The big odd duck here are the heat and sun sensitivity. Those I got diagnosed with in 8th grade because I was growing up in a hot desert. It was going to be fairly obvious, and it sucks. Even here, it can suck in the summer, because if it's warm or bright enough out, I'm going to be wiped for the rest of the day, if not a couple days after. But everybody gets tired and fatigued, right? Or just random fatigue, that's normal. But yes, rheumatologist, the only positive autoantibodies I throw are the anti-nuclear antibodies and the anti-centromere B antibodies, a pattern most consistent with scleroderma. So with scleroderma, there's kind of two main clusters or types. Diffuse, which tends to be a more big situation happening that hits the lungs and kidneys, and local or limited, that hits specific things. Both are overall caused by the body producing too much connective tissue, specifically collagen, possibly as a result of the immune system attacking healthy tissue. And doctors love their mnemonics. CREST is the one for the limited version of scleroderma. Calcinosis is the deposition of calcium in soft tissues, and this can happen in the skin, which will be fairly obvious, like on the knee there, but it can also happen in organs like your kidneys, leading to kidney failure. Raynaud's, as I breezed past earlier, is clinically cold hands, and this is caused by the blood vessels that supply blood to the periphery spasming and kind of shutting off blood flow, resulting in the cold. And it's cold enough that they're kind of white. I mean, I'm going to do color processing, but they're a little white right now. And when the spasm ends, blood rushes back in pretty aggressively and your hands end up warm, and mine, I don't know if this is normal, end up swollen and it hurts. So when they're exceptionally cold and white and like it can be hard to move them, it's painful. And when the blood returns, it's painful. And something that I've noticed more recently in the summer is when it's warm enough, it's like the blood flow can't come back out and they just end up like swollen sausage fingers that hurt. The esophageal dysfunction leading to dysphagia here is a result of the connective tissue forming an excess around the esophagus, leading to the problems in swallowing. It was emphasized to me repeatedly that my dysphagia was not this in nature. Just to clarify, sclerodactyly is a thickening of the skin on the fingers and I think other parts, but primarily the fingers, that eventually results in like a tightening of the digits. I know a lot of words, but this ain't one of them. So telangiectasia, it's basically spider veins that happen on like the face, the palms of the hands, and mucous membranes. So that's fun.
Yeah,
You're gonna fall off. So I have the autoantibody pair most associated with the limited form of scleroderma. So the one associated with these symptoms, but I only have Raynaud's phenomenon, not the other stuff. But Raynaud's is not specific to scleroderma. It can also show up in somebody with lupus or Sjogren's syndrome. But given the antibodies I have, it cannot be said my rheumatologist has done nothing for me because she ordered the test most appropriate for that diagnosis, starting with the echocardiogram. I've colloquially heard this called an echo, but it's basically an ultrasound of your heart. And the cool thing is, it's not just like the structure they're looking at, they're also looking at the blood flow. Like they change the frequency of the sound, I think, and they can see sort of like a Doppler effect, what the blood's doing and if anything weird is happening there. So an echo, it's the normal ultrasound problems. It's an A, although it does have a little extra weirdness in having to maneuver around certain bits of anatomy to try to get a good angle on the heart that this guy in this picture isn't really having to deal with. The other test was of my pulmonary function. Basically, how my lungs be doing. Specifically for me, how much air I was able to move in my breaths, so how much function my lungs have. And this was done in a spirometry, or spiro to the cool kids. But there are other pulmonary function tests that I did not have done. The version I did is like this picture. Sat in a little booth that was enclosed when the test was going on, had a nose clip, and was breathing forcefully, sometimes through the spirometer. And I know there was a series of different breathing conditions I had to do. It's long enough ago now. I don't remember what the directions were. And there's not really much to say in ranking this one. I thought it was pretty fun, but the nose clip was uncomfy, so A. Both these tests found nothing out of sorts. And my skin doesn't resemble the skin of somebody who has scleroderma. Like, I don't have those symptoms. But with the pattern of things wrong with me, like hitting my nervous system in various parts, I think it's reasonable and natural for me to wonder if there's some systemic thing going on under the surface that's causing all of this. So we're going to go on a little field trip, a knowledge excursion for a sec, so bear with me. There is a heaping handful of autoimmune conditions wherein your immune system oopsie daisies itself into attacking your body. So we just talked about scleroderma, which is one of them, but I think there's a handful that are sort of in the cultural milieu at this point. I don't know. So there's multiple sclerosis, or MS, where parts of the nervous system, specifically the myelin sheaths that line your nerves, are attacked, resulting in a decreased ability for your neurons, to transmit information, and that can cause the deficits seen in MS as well as the pain. Systemic lupus erythematosus, which I think most people just know as lupus, where the immune target are endogenous, so self-produced proteins, particularly in cell nuclei. And type 1 diabetes, where pancreatic cells that typically produce insulin for you are destroyed by the immune system. Reduced endogenous insulin, reduced ability to handle glucose. For each of these and the autoimmune conditions in general, the diagnostic label or category comes from what part of the body is being attacked. So in Sjogren's syndrome, the primary target are your exocrine glands. So broadly, these are the glands that help keep you moist and lubricated. You have things like your lacrimal glands in your eyes, helps tear production, and salival glands in your mouth. So the lacrimal glands get hit, you have dry eyes. Salival glands get hit, you have dry mouth. The most common presentation of Sjogren's is somebody with dry eyes and dry mouth. It's what is typically associated with this syndrome. That said, there can be other organ involvement like the lungs, kidneys, and the nervous system. And if the nervous system's getting hit, that can look like trigeminal neuralgia and other neuropathies on top of autonomic issues. But as is the case with many things, there are diagnostic difficulties. Diagnosing somebody with Sjogren's isn't a simple, easy process because 30% of people who have Sjogren's will be seronegative for the specific markers. It's like SSA, SSB. 30% of the people with Sjogren's, with the symptoms of it, won't have those biomarkers. Furthermore, I've read a couple papers suggesting that there might be more than one subtype of Sjogren's. There's the type that presents classically with the dry eyes and the dry mouth, and they are more likely to have the Sjogren's antibodies, SSA, SSB. And then there's another type that has anti-centromere antibodies, the type I have. And people with the anti-centromere antibodies may have the SSA, SSB, or they might not. And with the anti-centromere antibodies, they are more likely to have Raynaud's syndrome, like I do. So, armed with this knowledge, I re-examined the various problems I've had. And one of those things is in true probabilistic fashion. When somebody tells me dry eyes, feeling like you have sand in your eyes, I assume it feels like you have sand in your eyes. Because remember, I grew up in a desert. I know what it feels like quite well to have sand in my eyes. It's like a gritty feeling, not burning. It's never been burning for me. And I have this thing, have for years, where spontaneously my eyes burn. Just burn. Doesn't matter if they're closed, they're open, it burns. I put eye drops in, it burns worse. It just burns and it sucks. Got tired enough of it happening because it's painful, especially when you wake up with it. Finally remembered to ask at the eye doctor on the yearly checkup, and yeah, you got dry eyes. Try the preservative-free eye drops. They'll probably burn less. I have to keep my mouth lubricated. It doesn't do it on its own. When I was younger, so like middle school and I think even elementary school, I was the kid that had mints, I had gum, I had something, because I had to help the spit happen. It wasn't just going to happen on its own. But with this flaring up, playing with stuff in my mouth makes this worse, because I'm activating it and stuff. So I switched. I am now team hydration. I'm just sipping all day. Hydration level is not an issue with me. I drink at least 2 liters of water every day on top of like teas and other things, just to keep my hydration level up, to keep my mouth lubricated, because it's not doing it on its own. When I have to do the general anesthetic prep and I'm not allowed to drink for hours before, that's brutal. Like by the time I'm being wheeled into the OR, it's like SpongeBob in that one episode, just water. Also, I asked my dental hygienist about this and poked around. She tried to milk one of my salivary glands and didn't get anything. So yeah, seems reasonable for you to have a dry mouth. Also, as a consequence with the dry mouth is a dry throat. And if you have a dry throat, apparently for your immune system or the immune process to catch invaders coming in, spit helps. And if you don't have the spit, they adhere to the wall and they're able to invade easier. And I catch anything and everything. My husband brings home everything he encounters at work, or at least that's how it feels, because I'm gonna get it. I get it. I can look at somebody who's sick and I get it. It's bad. And you know, I thought maybe this was sort of like a moral failing. I must be doing something wrong with my hygiene that I just catch everything and anything, but maybe I'm working at a disadvantage. And other things are dry. Other exocrine glands are not excreting like they should be, and we'll leave it at that. Other than it started, at least in high school, that's when I first noticed it, shall we say. Neurologically, I've got the trigeminal neuralgia, I've got other neuralgia problems going on, and on the autonomic front, something I've yet to get somebody to take me seriously on, I can get dizzy when I stand, but again, ebbs and flows. It's not just always consistent. And I can feel full pretty quickly. Like I eat like a bird in part because of it, but also not. It's weird. And to just emphasize, in case I get the random doctor who might be able to help me on this, catch this video and tell me what to bark up next, this all comes and goes sort of together. Like it all feels so related, and I've yet to have somebody like key in or care about that, even like the good neurologist. So, given my general frustration with the reluctance of my rheumatologist to do anything further, and I'll expand on the frustration in the conclusion because it does overlap with the nerve stuff. Once again, I set about self-advocating, and many back and forths with the rheumatologist later, very terse messages, she finally acquiesced to ordering me the gold standard test for Sjogren's. As such, I only really have myself to blame for this, but I was so desperate for the rheumatologist to just do anything, and this felt like the last hoop I had. So we did a lip biopsy. With this type of lip biopsy, they kind of fold your lip over, numb the area with a local anesthetic, and then cut into it to remove several, as many as they can find in that little incision, salivary glands, which will then be examined under a microscope to look for signs of inflammation or destruction. I'll just throw in here now, for no reason, that roughly 20% of people who are otherwise diagnosed with Sjogren's will be negative on this test or on this measure. This test gets a D from me because my expectations were not set properly for what my experience was. Everywhere, doctors you talk to, websites, videos, whatever, say, it looks worse than it is. It's not that bad. And I now have a general rule going forward. If somebody says, oh, it looks worse than it is, it's not that bad, ask them if they've had it done. Like, we have a friend who is an optometrist, no, not sure which, and they practice on each other in school. They have gone through a lot of the things, maybe not LASIK, but, a lot of the tests they do, they've experienced a fair bit. I'm willing to bet that the surgeon, rheumatologist, like all of these doctors have not had this done, because I find it hard to believe that they would sell this line like they did. I know this is a bit of a long video, but if you've been paying attention, you will note that this is the third type of biopsy I've had, and easily the worst. The mole removal biopsy there, it was a big chunk removed. It healed fine. It felt fine. It's kind of out of the way. The hole punch biopsies, a bit scary because of how deep they went, and other than some aggravation with the shoe, it was fine. They healed fine. It's fine. Lip biopsy. So it was in my mouth, and you might notice that I need this to talk and to eat. So it's not like you can just take it easy. Like, let's get moved. This was done in May, so several months ago, and I'm still struggling to pronounce some phonemes because of the scar tissue. Like, my lip just doesn't flex like it used to. Not an issue for these other ones I've had. And of course, as is the case for so many of the things going on with me, test came back negative. As far as they could tell in the biopsy, the salivary glands that they got were fine. No signs of destruction or inflammation. The mouth dryness and all the other things gets to remain a mystery that nobody is interested in solving but me. Conclusion. So talking about the final rankings, by and large, I think I'm pretty tolerant of the things that my body's been put through medically. The esophageal manometry is just that bad. But if I had to do it again in the go back in time sense with the knowledge I have now, I would. It was a useful test that got us useful information. That said, if I had to do it again in the future, no, I will do everything else but that stupid test. Unsurprisingly, things in my S tier were quick, easy, and relatively comfortable. I'm sure baby me would disagree about those shots. A lot of the A's are in there and not up in S because there's important anxieties or concerns or something about them. Or goop. I don't like leaving goopy. As we continue down, we get into more and more discomfort, especially as this becomes more and more relevant with its hair trigger. I also generally have a pretty low tolerance for woo treatments or things that waste my time. It's kind of interesting seeing it all laid out like this, that I'll put up with all kinds of things if there is a tangible benefit or payoff, but quackery is right above absolute torture. And as promised at the outset, here's the current state of things, the treatments, future plans, what have you. So digestive, as we talked about, the poem, fix things for me. Food swallows, drink swallow, it all goes down, and I just have to deal with acid reflux periodically. I will have to get endoscopies roughly every 3 years to make sure nothing bad is developing, but it's fine. On the neurological front, trigeminal neuralgia, medical pain management seems to be the way forward for this. The pain doctor, at some point a couple years ago, talked about doing a nerve block here for me and a possible ablatement. And yeah, no, as gung-ho as I am everywhere else, a needle going in through my nose to try to access that with the risk of it going too far in puncturing the brain, not a fan. The potential numbness and paralysis, also not a fan, especially given my line of work. Interestingly, I asked him about an ablatement back here, to jump ahead a sec, and he discouraged me from it because you could possibly cause neuritis, which is something he warned about up here. But he was so against it down here that, we have to get it precisely right, otherwise we're going to inflame the nerve and make it worse. Whereas up here, no, it's fine. It would be good. Even though like half the people, it either doesn't benefit them or it gets worse. I still think we should do it. The muscle spasms and twitches, treatment seems to be baclofen for that. Half the dose that the neurologist says the full dose, so that's 5 milligrams every night instead of 5 milligrams in the morning, 5 milligrams at night. The full dose, it was making it super easy for me to get pretty nasty headaches, and at the half dose, it's easier than my baseline, but it's not as bad as the full dose was. And it turns down the intensity and the likelihood of those spasms and twitches, but it's not zero, especially in the transition periods between the hot and cold parts of the year. The numbness, though, despite all the tests we did to rule out potential causes of it, no treatments have been offered. Well, I haven't exactly pushed for one either. We also don't know why, or at least I don't know why, the numbness, the tingling, the shakes, the spasms happen. And I feel like I've pretty much exhausted the mainstream normal tests that the neurologist had. So I don't really know if there's other things to do that would be less mainstream or less normal that isn't on our radar for some reason, or it's just because I haven't asked for it because I don't know to. I don't know, but the cause is unknown. Dizziness, we seem to have some more definitive things. Vestibular migraines, probably because of hormones, given the timing of everything, and Ubrelvy, I think that's the order. It's either Ubrelvy or Ubrevly. Migraine abortive medication that's relatively new. Works. Just take it in the first couple days, especially if I feel that Alice in Wonderland like aura. I can take it before the dizziness really sets in, and usually it prevents the full dizziness thing from happening. My coordination might be a bit like loosey-goosey, but I won't have the full dizziness happening. The treatment for the occipital neuralgia looks like it's going to be nerve blocks every couple months. We did talk about doing a permanent ablatement on the nerve, but I don't know, the risk of permanent numbness on this huge chunk on the back of my skull when I can barely deal with it for a day, it's a non-starter for me. So I get to go back every couple months, spend a couple $100 because it's counted as an in-hospital visit, even though it's like bop in, bop out, and whatever. And the focal rib pain, this thing. Yeah, so I had the nerve block for that 11 days ago, and I had done my darndest to try to trigger it in the meantime. Like, scripting, did what I normally do, and that seems to normally trigger it, and it didn't fully. There was a weird tightness that happened in the area, but it didn't like coalesce into that singularity of awful pain. Until today, filming. So, yeah, not entirely sure what that's going to mean. Well, I started filming this 12 hours ago, but I haven't been doing this the entire 12 hours. I've had to take 3 breaks because this was getting too intense and too awful for me to continue and to think and have a normal sort of prosody in what I'm saying. And then again, it's not coalescing into that singularity of awful pain, but it's like it's spread out around where it normally would be. It's not great. Also with this, it was kind of interesting when they were doing it. I have a huge numb spot around where it is. Just not that you can see. Like this size area is just numb, but that's also where the pain is. It's weird. Numb in the sense that, like, when they were going to do it, before they wheeled me into the OR, they marked, like I pointed, and then they marked it. And when I got in the OR, they want to confirm it. And so they touched where the mark was, and it's like, I don't know if you're touching it. So I had to like position, which sucked because I had the IV in this arm, and poke it, and like, that's it, right? It's like, yeah, that's where the mark is. Okay, that's where it needs to go. Because I can't feel things there. It's weird, and I feel like that should also be indicative of something maybe, but no. And mysterious pelvic pain is mysterious. The tests that we talked about here, like the CT scan and ultrasound and all of that, were done before I moved to California. There has been some progress, sort of, since. Good timing, Max, because this is going to get gross. So, I don't know about you, but I generally didn't look too closely at my pee sitting in the toilet bowl. A couple years ago, that changed because the pain was particularly nasty, and it's like, okay, am I peeing out like a kidney stone or something? What's going on here? So I was looking, and okay, documentaries, ocean documentaries, coral mating, the into the ocean. That's what my pee looks like. That's what my pee has looked like for the past couple of years that I've been paying attention. And I managed to convince the doctor at the time to do some urine screens because, like, something's going on. I've got pain. There's no blood, but, like, something weird's going on. And always came back negative. There's nothing there. And it just, how is there nothing there? How are they not finding anything? I can see stuff in there. And, like, it floats around. It doesn't just sink to the bottom. I can see it. Surely they can see it. I'm not hallucinating this, I don't think. And yeah, I had to develop a mantra in this of, it'll drive you crazy if you let it. Because for a bit, it was. I bought the little urine dip stick test things for like potassium, proteins, pH, all of that. Because it's like, there's stuff here. I can see it. How are they not finding it? But then I didn't find it. And yeah, just, it'll drive you crazy if you let it. There's stuff in there, but it's nothing anybody's concerned about. So until things change, just let it go. Earlier this year, something changed. Continuing the grossness, the excessive grossness, particularly bad pain. Like, I scheduled a urgent care appointment the next day because it was like, okay, this is exceptionally bad. Walking around the house, like, leaned over because it was like, whoo, So I was paying extra super close attention to my pee because surely a kidney stone's going to come out of this. Not a kidney stone. It looked like a sea dragon. You know, those nice seahorses? It looked like that. A little over a dime sized. I know, for non-Americans, it was like a centimeter. A little over a centimeter long. This nice little thing and a bunch of other chunks of stuff. You know what? I said I'd be frank in the opening of this video, and I personally would want to see the picture, so I'm going to do it this way so you can sort of just opt out of looking at it. So in 3 seconds, I'm going to put it on the screen and then hold it on the screen for 3 seconds. I'm going to keep talking so you can just like close your eyes during this if you don't want to see it. So if you don't want to see this weird little picture of this weird little thing that I kind of birthed, look away in 3, 2, 1. So that's it. It's a little over a centimeter long at the longest. It's not rigid at all. Like, it was very floaty. That's why I said sea dragon. And yeah, it is now off screen. We are safe to continue. Important information, I would think. The pain stopped as soon as I was done with all of that chunks. There's still like the coral splooge, but the chunks seem to be related to the pain, the excessive pain. Next day, go to urgent care and have an incredibly thorough physician's assistant who does a full pelvic exam, blood work, pee test, all of it, and then gives me a referral to urology. Also looks at the picture. She suggests maybe it's interstitial cystitis. So I've basically just started this process. We are brand new into this, relatively, because I had those other tests years ago. I've met with the physician's assistant for urology once. Like, in this office, there's a urologist and then there's a PA. I don't know. So if this is interstitial cystitis, which is also known as bladder pain syndrome, guess why it's named that? What I'm seeing could potentially be bits of the lining of the bladder wall sloughing off. The urology physician assistant didn't seem to quite know how to interpret the picture of the sea dragons, as well as the urgent care PA. Like, she called it very artistic, but like was having a hard time making sense of it, but wanted to show the urologist because he was there that day, because he bops around between different places. And unfortunately, I just missed a window before he went in for another appointment, so he couldn't just look at it while I was there. So I got a message later. We are new with these doctors and we are trying not to be triggered because, woo, in the appointment and in the messages, there was a bit of the, no, this, are you sure it's not normal for you? Are you, well, I mean, it is normal for me at this point, but it shouldn't be, I would think. But the thing that absolutely just killed me and floored me and what is going on, apparently the urologist looked at the picture. I don't know how much information on the scale was given. It looks like it could be normal. Excuse me, something this long, this wide, and like ripply, chunks like that are normal. My pee looking like coral spooge is normal? No. No, I refuse to believe this is normal. Maybe correct me in the comments, but no. Especially because this didn't happen when I was substantially younger. So the next thing on the docket there is an ultrasound to check my kidneys and the bladder. Make sure there's like no tumors, no cancer, which should be interesting because something I haven't talked about here is I got checked at some point because for a bit, I was having like a weird pain that I was worried was gallbladder, and like around my age right now, my dad had a gallbladder attack and had to have his removed. So I want to make sure that wasn't going to happen. Had an ultrasound done, and the only thing of note were my kidneys are hyperechoic. So they look lighter on the ultrasound because they're extra echoey, I guess, or extra reflective, which, the lab notes for that, or radiologist, sonologist, I don't know, were like, well, you know, this is normal for young adults. I'm pretty sure somebody in their 40s isn't a young adult anymore. Correct me if I'm wrong. Pretty sure I'm out of the young adult stage. I mean, I keep getting compliments on the quality of my skin, but like, come on. Come on. No answer yet, but progress is progressing. Oh, and also the PA gave me a medication to try for the pain. It doesn't like address the underlying cause of the pain, but it makes the pain go away. It's like a dye, apparently. So it turns your pee like orange to red. It works. It helps. So that's something. Not nothing. And on the autoimmune front, unfortunately, my plan right now is to time out the current rheumatologist. So I think I mentioned earlier that with this healthcare system, if you don't see a doctor within 3 years, you're kicked out and have to enter the system as a new patient. I don't trust my ability to pick a rheumatologist blindly and get somebody who will treat me and not the blood work. So yeah, just have to wait a year and some change for that to time out, and I can get the process started for a new rheumatologist. Undifferentiated connective tissue disorder is a diagnosis unto itself despite the rather vague name of it. And it has its own treatment protocols, standards, and prognoses and all that. I need a doctor who is not just going to dismiss me because my blood work is looking a certain way, but listen to me about the symptoms I'm experiencing and work with me on trying to help treat me to make me feel better. Especially with all of the reading I've done and the research, and not Facebook research, but like digging into the medical journals research suggesting that like the pelvic pain and the neurological stuff could have an autoimmune component underlying them. Yes, it could just be a random coincidence that I have all these things going on and they aren't actually connected, but there's treatment protocols for the diagnosis that this rheumatologist gave me. Could we try those, especially before I start doing all these other stupid things, trying to just put band-aids on everything, when I could potentially just take like a autoimmune drug like hydrochloroquine and see if it helps. Just see if it helps. I say things are better, but then they're largely better. This is just the sore point. And now, last slide. The final concluding thoughts of this whole big long thing. And if you're still here, thank you, Art. Thank you, Max. Thanks you too. Keep your head in frame.
Yes.
Things are by and large better than when I did the medical limbo video. By and large, big picture, I'm in a better place than I was. But as was true in that video, I am the driving force of progress in all of this. In the best case, my neurologist is great, but it's still largely on me to remind her about things or ping her when like a referral has gone missing. And I get it, like doctors are pulled in more and more directions, and it is beyond her to remember all of these things. And the system, it errors sometimes, doesn't always remind her about stuff. Although neither do I. Like I have an appointment with her in a couple hours that I was supposed to have last month, and it just, with everything going on, I spaced making it. Worst case situation, I'm barking up everyone's tree because a referral has gone completely missing in some weird little space where nobody can see where it went. That happened before. More than once. It's not great tracing down that error. So staying on top of all of this and doing all the self-advocacy and pinging and reminding and messaging and research while feeling like garbage isn't great. Like, it's a sad reality of my life for the past couple of years since a lot of this kicked off, that my first job, my primary job, is working on my health. My actual job, the YouTube stuff, is second tier to that. And, you know, my channel's suffering as a result. Like, yeah, the calls that YouTube does periodically, a lot of months I'm losing subscribers. Net, instead of gaining. It sucks. Subscribe? We're getting close to being in a place where I can pivot back to the health stuff being the secondary and work being primary, but with how this is acting today, I'm not as close to that as I thought. All that complaining aside, I do need to acknowledge that I'm incredibly lucky to be in the position I am, that I have health insurance and access to all the different specialists and everything, even if they are booking 3 months out, if not longer. A lot of people don't have that and just have to try to make things work as best they can. So I'm very fortunate in that position. So yeah, hopefully you got some information out of that, or at the very least have a better sense of how I'm doing. Doing better. Still have room for improvement. Unfortunately, it's going to be a ways out with the rheumatologist. Unless she moves. That's always a possibility. People move. Although it's never who you want to move, right? It's the people you want to stay that move, and the people you want to go who stay. I think I'm out of words. Like, I am literally out of words on this thing. What do you think, Max? You got anything? So I think it's time to call this video good. I've said enough things. Enough things for a bit. Probably be another couple years before there's meaningful changes to talk about again. And who knows what angle I'll find then. Anywho, hope you guys have a good rest of your month and a good rest of your year. And until next time, bye.